Veterinarians face a unique set of challenges when it comes to safety, especially when dealing with the spread of disease. Preventing the spread of disease between animals and to people is an essential part of the job. This video is about knowing when and how to suit up. Personal protective equipment, or PPE, can take many forms, from the simple, such as wearing gloves for treating wounds, through to the more complex, such as respirators and overalls for high-risk situations. The type of PPE that is required varies for each individual situation, and it's the job of the veterinarian to assess the level of risk and choose the appropriate PPE. In assessing your level of risk, you need to balance what diseases might be present, your likelihood of contracting or spreading those diseases, and how you can appropriately protect yourself from any possible danger. Once you've assessed the risk and chosen your level of protection, you need to make sure you're using the right equipment for the task. Here are a few key points to consider. When protecting the face and eyes, safety glasses protect against splashes but not aerosols. Goggles are better suited for protection against both splashes and aerosols. Face shields are another alternative to goggles, but only protect against splashes. When protecting the airways, every face is different, and it's important you pick the right respirator and have it fitted correctly. P2 particulate respirators aren't effective if they get wet, so they must be kept dry at all times. Have more than one respirator in your kit in case one gets wet. P2 respirators do not work correctly with facial hair. A powered air purifying respirator is an alternative if shaving is not an option. If you've assessed the situation as high risk, such as a suspected Hendra virus case, then you're going to need to use full PPE and follow these steps to protect yourself and other animals from infection. Place a tarp on the ground between you and the animal. The dirty side of the tarp is the animal. The clean is the side you're on. Lay out all your necessary veterinary equipment on the tarp, such as a first aid kit, needles, syringes, stethoscope and thermometer. PPE should then follow: impervious overalls, rubber boots, multiple sets of impervious, preferably nitrile gloves, protective eyewear and a P2 respirator. You'll need a container for contaminated PPE and equipment on the dirty side of the tarp. A disinfectant foot bath with scrub brush should be set up between your tarp and the animal to be examined. Once you're set up, here's how you put on your PPE. Firstly, wash your hands with soap and water and dry thoroughly. Check your hands for any cuts and cover them with waterproof dressing if necessary. Remove your footwear and leave it in the clean zone between the tarp and your vehicle. Step into the clean zone on your tarp. Put on impervious overalls. Do the zipper up to your chin and leave the hood off. Put on rubber boots or other appropriate footwear. The overalls should be pulled over the boots, leaving as little of the boots exposed as possible. Place the P2 respirator over your mouth. Secure the straps over your ears and behind your head. Perform a fit check to ensure a proper seal has been established between the respirator and your face. Breathe in and out to check there's no air leakage around the respirator. Make faces. Turn your head from side to side and up and down to ensure the respirator will not slip during your examination. Put on protective eyewear. Make sure the eyewear is positioned over the top of the P2 respirator. Pull the hood over your head and close the zipper as high as you can. No part of your face should be exposed. Put on inner gloves. The cuffs should be under the sleeves. Put on a second set of gloves. These cuffs should be placed over the top. Tape the sleeve cuffs to the overalls if necessary. To repeat, wash your hands and cover cuts. Remove your normal shoes. Then on the tarp, put on overalls, boots, respirator, eye protection, pull up your hood, then inner and outer gloves. There are some common problems you might encounter when putting on PPE. If the overall zipper breaks, you should put on new overalls if you have them. If not, hemostats, towel clamps or clothes pegs can be used to close gaps. If your gloves don't fit well, they can get caught in your overall zipper. All your hair needs to be underneath your hood. People with long hair that cannot be securely tied back should consider wearing a hairband. P2 respirator fit is crucial and often overlooked. Get a fit test performed annually and make sure you do a fit check every time you use a respirator. Body piercings can be an entry portal for contagions, so you need to make sure any piercings are covered and aren't damaging your PPE. Leather footwear is not impervious and is hard to decontaminate, so you should avoid wearing leather shoes in high-risk situations. Working in PPE can be difficult. PPE can get very hot very quickly. PPE can restrict your vision and movement. If possible, have an assistant to help you. Taking off PPE incorrectly can increase the level of damage caused by the situation. Taking off PPE needs careful planning. First, scrub the exposed parts of your boots with soap and water using a brush. All particle matter, contamination and dirt must be removed. Step into the disinfectant bath and scrub some more. You may now step onto the tarp. Next, remove your outer gloves by turning them inside out. After removing the first glove, slip one finger inside the outer glove on the other hand to avoid touching the contaminated side. Turn this inside out as well, leaving the first glove rolled up inside the second. Put them into contaminated waste. Remove your overalls. Minimize touching the overalls as much as possible. Once the hood is pulled back and overalls unzipped, remove them, but do not touch the outside of the overalls. Roll up your overalls and put them in contaminated waste. If at any time you touch a contaminated part of your PPE, don't panic. Just wash your hands with disinfectant and then continue. Step onto the tarp and remove your boots, being careful to only handle the unexposed part of the boots. Put the boots into a plastic bag for further cleaning and disinfecting off-site. Lean forward and remove the eye protection by pulling the straps from the back of your head forward. Put it in contaminated waste. Remove the P2 respirator in the same way and dispose of it in contaminated waste. Do not touch the front of the mask or eyewear at any time. Remove the remaining pair of gloves in the same way as the first, taking care not to touch the outside of your glove with your bare hand. Put them in contaminated waste. Wash your hands, arms and face with soap and water and dry thoroughly. The sequence for safely removing your PPE is: clean and disinfect your boots, then onto tarp, remove outer gloves, remove overalls, remove boots, remove eye protection and respirator, remove the inside gloves last, then wash your hands, arms and face. There are some common problems with taking off PPE. Touching the outside of overalls during removal, getting stuck trying to take arms out of the overalls. Troubles with not being able to get boots out from underneath overalls are common. This is solved by removing your overalls first. Touching the outside of gloves during removal. Not leaning over when removing eyewear and P2 respirators. Touching the front of eyewear and respirators. Depending on the situation, there are certain factors to consider when deciding whether to disinfect or dispose of your PPE. In high-risk situations, disposable PPE should be used. Disposed items should be double-bagged and the outside of both bags disinfected. In a normal, low-risk situation, disposable items such as gloves should be placed in a sealed waste bag and disposed of as clinical waste. Items made of fabric should be rolled up, contaminated side inward, and washed in hot water and detergent. Non-disposable items, such as goggles and stethoscopes, should have organic matter removed, be washed in hot water with detergent, and then disinfected. By learning and following these steps in the correct use of PPE, you are protecting yourself and others from the spread of disease.